Hello, everyone. Welcome to our session of Hello Health for today. My name is Caroline Price. I'm the Administrative Officer too with the Connected Care Program. And today we have our speaker, Alba, and I'll let her introduce herself.
Hi, good morning, everybody. My name is Alvin Natali. I am the Public Health Nursing Supervisor of the Communicable Disease Branch at the Cumberland County Health Department.
Right. And our topic for today will be tuberculosis. So we will go ahead and turn it over to her and let her tell us about that.
Okay. I think it's important that we talk about tuberculosis. Did you know that about over 1 million people die a year of tuberculosis? And so it's something that we don't often think about, but tuberculosis is still something that is it's killing people worldwide. On March 24th, there is a World TB Day. They celebrate it every year. It's to raise awareness. It's to make sure that people know what tuberculosis is. And so I thought it would be important and it'd be fun to talk about tuberculosis just so our community members know what that is. So tuberculosis is it's a respiratory disease. It's some germs that go into your lungs and that can cause fever, chills, body aches, night sweats, but mostly it can cause death if it's not treated. And so our job at the health department is to make sure that not only do our community members know about tuberculosis, but that if they do have it, they get treated and it gets cured and it goes away.
So, what are the signs and symptoms of tuberculosis?
Okay. So tuberculosis, there's a couple different stages, right? So there are 3 stages. Our main concerns are latent TB and active TB. So when you are in one of those stages, the symptoms can look different. For latent TB, that's when the germs have entered your body. Your immune system is kind of trying to kill them off. So they kind of go to sleep, the germs, and they don't bother you. They don't cause any sign or symptom. You can't infect someone else. And so really, you don't even know that you have it. And so during that stage, that's when we want to make sure that people take medication so like that they never get active TB. Active TB is where you are the most infectious, where you can spread it the most. This is where you get a cough. It's been about three or more weeks. Maybe the cough, there's some blood. Maybe there's or you have night sweats, you have fevers, you have chills, like a lot of flu-like symptoms. Which right now during January, you could think it's just the flu. So we want to make sure that we look out for those symptoms. We also want to make sure that the people who are high risk are getting tested. And so people don't really know who's at high risk, right? So if you work in the healthcare field, if you work in the jail setting, if you live in congregate settings, so like if you live in nursing homes, or if you work in jail or live in jail, or if you know somebody who already has TB, we want to make sure that you get tested often. For those, you have to make sure that you get tested at least once every 6 months, once every year, depending on your maybe organization policy. But we want to make sure that we get tested, especially if we have immunocompromising conditions, like if we have HIV or AIDS. We want to make sure that we get tested often because HIV and AIDS together with TB can be deadly.
So, are there certain ways that we can prevent tuberculosis from occurring?
Yeah. So, just with any respiratory disease, we want to make sure hand washing is always number one, right? With respiratory diseases, we also want to make sure we wear masks, especially if we have a cough or if we know somebody who has TB. We also want to make sure again that we get tested. I think testing will be the best way to find out ahead of time if you have tuberculosis. With latent TB and active TB, that latent TB, you're going to get a test either in your forearm or you can get a blood test. That can let us know, hey, I've been exposed to tuberculosis. I might want to follow up. You get a chest x-ray to make sure that you don't have anything going on in your lungs. Based on that, your provider will determine if you need medication. With latent TB, if you do not take the medication, you might still feel really good, but you could develop active TB within months, 2 years. And we don't want that because that's how it spreads. So testing ahead of time, testing often is very important, and then doing those masks, hand washing, making sure that you cough that want to do that. Those are going to be some ways to prevent TB.
So, it is curable when it is treated.
Yes, ma'am. It is definitely, but the biggest part is to make sure you take your medication. We want to make sure, especially in the health department, that we educate people on latent TB. And I think that sometimes is the confusion in our community because people often think, well, I don't have symptoms, so I'm okay. But if you don't take medication during the latent TB, you can get active TB. And we don't want people going to the hospital. We don't want people spreading it. TB is it's so important that we have to make sure that we are monitoring it, that we make sure that we do contact tracing. So, for example, if you have tuberculosis, I want to make sure that the people that you're around get tested so they don't develop tuberculosis. And so it's really important that we make sure that we take all our medication. Medication could be anywhere from a couple months to almost a year, depending on how serious your infection is. There are things that we take at the health department. So we tell people we got to stay home. We can't be around people until you're not infectious anymore. You have to take your medication for 4 months in a row. There's different antibiotics, and we make sure at the health department that we are educating people and that we make sure that they are not spreading the infection.
So I know that there is a World Tuberculosis Day. When is that?
So World Tuberculosis Day is March 24th. And like I said before, this is a global issue, so it's not something we worry about it in Cumberland County. We have some many cases in the United States. We have a lot of tuberculosis cases, but globally, like I said, it kills over 1 million people. And for something like tuberculosis that we have the medication to treat, it's still staggering that number. We should be able to treat it and get rid of it, but unfortunately, in third world countries and countries that don't have the needs and the resources, it's still widespread. So March 24th is a day that the World Health Organization has designated as an awareness day. So we talk about it. We do things like this. We go on podcasts. We give education to the community. We're out there spreading the message to make sure that people know that tuberculosis is still very well and alive, and there are ways that what we can do to stop the spread of TB.
So what would you say that the health department's main role is in response to kind of mitigating tuberculosis in our community?
So tuberculosis, for what we do in our clinics is we want to make sure that our goal is surveillance and reporting. So I think there's a misconception. Everybody gets sent to the health department. Go test for TB. Yes, you can test for tuberculosis in the immunizations clinic, but our role in communicable disease is to make sure that those people who are actively infected or who have latent TB take their medication. Our role is also to make sure that we are stopping the spread. So if there is someone who is positive, and let's say just say they're a healthcare worker, that we are doing contact tracing, that we are giving people medication and testing, and that we're reporting to the state and the CDC to make sure that they know what's going on. So we do a lot of surveillance, we do a lot of reporting, we do a lot of education, and that's even to healthcare providers. There are a lot of myths out there about tuberculosis. There are a lot of misconceptions about when to test, when to give medication, when to do a chest x-ray. So we do a lot of education, especially to our healthcare providers and outside sister agencies to make sure that everyone is on the same page.
So again, looking at ways to prevent it, can it go into more detail about that again for me?
Sure. So preventing tuberculosis, right? We want to make sure that we get tested often. I think when you're going to school, you are like a college. I think you have to do a PB test. When you work in a healthcare facility, you have to be tested every year. When you work in a jail setting, you have to be tested. So preventing really is making sure that we are testing ourselves before we get exposed, that we are aware of our environment. So if we work in a jail health setting and you start noticing a lot of people are coughing, I think it's important to have a really good communication with your health departments to say, hey, I've noticed a lot of people coughing. Maybe it's the flu, maybe it's COVID, maybe it's TB. So we want to make sure that we are have a good um, conversation with those jail health people, so we know that we can stop it right then and there, or at least test for it. Wearing a mask. If I have a family member who is sick, wearing both of us wearing a mask. And I know it kind of seems kind of weird. We live in the same house, but a lot of times tuberculosis is spread in household because we all live together. There's 5 of us, or we're all coughing on each other, and so it's really important that we take those easy measures to make sure we don't get spread it.
So, and I'll, bring COVID into this, have you all seen, in the clinical space, have you all seen an increase, since COVID in cases of tuberculosis in our community? Or is that something that's kind of, uh, been shifted a little bit since COVID?
So tuberculosis is kind of a little it's a hit or miss kind of thing. So it doesn't really follow the same patterns as COVID and flu. And it doesn't always, and I think another misconception is it's in people who are foreign born, maybe people from Africa, Asia, places like that. We have people who are American citizens who had tuberculosis. But it doesn't follow the same trends, but it does follow the same, it's a respiratory disease. So it's that coughing, it's that the flu like symptoms. So kind of knowing when to test or when to to go to your healthcare provider and be like, I do not feel good. But no, I haven't seen a increase in tuberculosis cases, but there are quite a few, and it's something that we want to make sure that people are aware, so we can decrease those case numbers.
So, and again, tell us how the health department kind of takes control over that. If you all see an increase in cases that come in, how does the health department actually again mitigate that and take control of that?
So first and foremost, tuberculosis is a reportable disease. That means that every healthcare provider has an obligation and a duty to report to the health department. That could be for a phone call, that could be a lab, that could be a fax. So once that comes into us, our specialized trained nurses jump right on top of that. So if they get a positive, what we call an IGRA or a positive TB test, and they contact that person and they say, "Hey, come to the health department. You know, we have appointments available." And we do have appointments. It's not a walk-in because we are worried about infectious diseases. So it's a appointment-based system. When they come in, we do a whole what we call an epi record. We ask questions, risk history. Do you work in jail? Do you work as a nurse? Have you traveled anywhere? So we go through that whole interview process. We send them for an X-ray, and depending on the results of the X-ray, we can start them on latent TB medications. Um, However, I can't force people to take medication when it's a latent TB, but we highly encourage them to make sure that they take them. Some people with active TB do not have that luxury. We want to make sure you have to take medication now. But with latent TB, it's a little bit more of a finer kind of. I really want you to take this medication. But once healthcare providers report to us, we take it from there. Our nurses are specially trained. All of our nurses are specially trained to educate, to test, to make sure that we are educating not only the patients, but we are communicating with our senior leadership to make sure that everyone is on the same page and know what's going on.
So, how would you say the Department of Public Health helps to ensure that those with TB complete their treatment in the right way?
So we have a great team. Again, our clinical disease nurses make sure that we develop a good rapport with the patients, and that we not when you educate someone, sometimes people kind of like, "Ah, yeah, I know what's going on, but do you really?" So we want to make sure we always make sure that we speak to their health literacy level, that their all questions are answered. We maintain constant communication. This is a daily thing. So people who have active TB, we have to see them every single day. I have to see you take your medication. And then every month they have to come in and get lab work, things like that. So we have to make sure that every single day we are one-on-one with that person.
So, what role does screening for tuberculosis play in public health, especially for those high risk groups that you all see on a daily basis?
So, I mean, that's just like anything else. High risk people, people who, again, who live in congregate settings, who work in jail, who are healthcare providers, that testing is going to be the number one preventive tool that you have. Um, it's really important that healthcare providers, that people who work in those high risk situations or who have immunocompromising conditions, that they get tested often. That's where you talk to your healthcare provider and make sure that you have a good rapport with them so you know when to get tested. There might be a different, people might want you tested every 3 months, every 6 months. So it all depends on where you go, who's your provider. But most of the time, it all goes back to that organization. Get tested every year, just to make sure that because we are high risk, that we're getting tested.
And so, are there any new, as far as what you've seen, any new advancements or challenges in the fight against tuberculosis in our local area, but even in our country?
Yeah, so just with a lot of many other things, antibiotic resistance is becoming a problem. We often treat tuberculosis, active tuberculosis, with a four-drug system. But sometimes we are running into people who are resistant to those medications. So now you have to add two more antibiotics, which, when you take antibiotics for a long time, could wreak havoc on the body. So that causes more, making sure that we are testing you more as far as your making sure your liver's okay, your kidneys are okay. But antibiotic resistance has been a problem for not only tuberculosis, but a lot of other diseases. And we want to make sure that all our healthcare providers, whether you work with tuberculosis on a daily basis or whether you test for it, here sparingly, that you still know that antibiotics resistance is it's a big problem. Yeah.
So say someone were to be diagnosed with latent TB, what do they need to do on their end to make sure that they don't ever get that again?
Medication. That's the biggest thing. So if you get diagnosed with latent TB, that means that you have a positive test, whether it's the blood test or whether it's that skin test. and you have a negative chest x-ray, the best thing is to take that medication. That medication is going to make sure that you get rid of the TB germs. Because remember, in latent TB, the germs are kind of sleeping. And while they don't cause any symptoms, you don't want to get it later on in life. Mhm.
So, anything else you'd like to share about tuberculosis while we have you?
Tuberculosis is a very serious illness that's easily treatable and curable. The Cumberland County Health Department is at your beck and call for tuberculosis questions. We have specialized, highly educated nurses who are willing to educate at the drop of a dime. If you have any questions, you could always call me directly. But we want to make sure that we are educated on tuberculosis and what it can mean for our community members.
Perfect. Perfect. Well, thank you all for joining us for our session today on tuberculosis. We appreciate your time. We appreciate you all being willing to learn a bit more about this issue in our community. Wanted to give you all just a few quick housekeeping points. There are some health department events that are coming up, outreach events, programs that are going on. So be sure to make sure that you look through your weekly updates and make sure that you all are aware of those events that are coming up. And we'd like to know how we did. So please take our survey. Let us know how we did. Let us know if we can improve on anything, and let us know what we can do better moving forward. There will be some links that will be shared at the end of this meeting. They'll be posted on our website as well. So you'll be on the lookout for those. Also, you can go to cumberlandcountync.gov if those links should be posted there as well. So make sure that you all take a look at those as well. If you all missed our live show for today, you can go to Cumberland County NCTV. That's a 24-hour channel that focuses on our government, our local government. So it does air on Spectrum Channel 5. So make sure that you all look at that if you all would like to watch a rerun of the show, or you all can check it out on YouTube as well. It's probably the best go to. So again, moving forward into next month, our topic will be environmental health. So please join us again next month for environmental health. If you have any questions, please go to hellohelp@cumberlandcountync.gov. Thank you all very much.